The initial symptoms didn't relate to, I didn't feel like I had tuberculosis. It was more or less like a chest cold or maybe pneumonia. You knew, or I knew, that something was wrong.
TB in our mindset is really a disease that oftentimes we forget. We don't think that it continues to be an issue, and yet TB is really a disease that we need to continue to be mindful of and also continue to promote our prevention efforts and ultimately our elimination efforts.
I was in the hospital about, I'd say 6 weeks. It was well over a month. From like the last of July until after Labor Day. The Harris County Health Department has a process they go through. When they began your treatment, they would have an interview with you. They would lay out the medications, explain to you what the medications are intended to do, what they are.
Going out and interviewing somebody who's sick with TB and then doing appropriate testing and referral for those patients is a huge part of prevention.
They come out every day, with you, Monday through Friday, with your medications. They sit there and they watch you take it to be sure that you're taking it.
My typical day is going to the patient, assess them, they ask if they're having any problems with the medications. And if they're not having any problems with the medication, then I will administer the medication to them and watch them take it.
I was surprised that the process takes a while. I was surprised that there are a number of steps involved. But the staff did indeed make me comfortable with the idea that it was going to be over at some point, and getting to that point was going to be as easy as they could possibly make it. I was surprised that the staff would be that personal or would take a personal interest in you.
I always tell them, ask me whatever it is that you think you want to know, because somebody else is going to ask you. And if I can arm my patients with the facts, then they can in turn help someone else. So I really love the educational part that goes on in our department. The
one thing I definitely want to say is thank you. Number two would be thank you again for being there and for being the kind of people that you are. It's not just a job with them. I got the impression that it's more or less a way of life for them. And I think they take pride in what they do. I think that they find their own successes through the successes of the patients. I get that from them. And so I would say to them, other than keep up the good work or some other kind of cliche, I think I'd just rather say thank you for all that you've done.